Good morning. Thank you all for joining us on this very special occasion. It's my pleasure to introduce Dr. Boris Lushniak, Dean of the School of Public Health, who will preside over today's ceremony.
Thank you, Dr. Farmer. On behalf of all the faculty and staff, I'm pleased to welcome the families, the friends of our graduates here at the School of Public Health, and especially to the graduates, a hearty congratulations. You've come a long way, haven't you? You know, and we've made a point of it to make sure that each and every one of you that are here today are honored in a special way, right? This is the one where you get your name called, right? This is where you're signified as an individual, and although it's only a few seconds of fame, that in essence is a culmination. I need to remind you that the word commencement is not an end. It's not an end. It doesn't mean it's over. It comes from the Latin word meaning a beginning. So as you walk across this stage later today, think of it as the beginning of what? Of doing good to the world that needs a lot of good. And it begins today, folks. It begins with this diploma. It begins on this next pathway. In addition to our faculty seated on the stage today, I'd like to take a brief moment to introduce a few special guests who have joined us. Dr. Leana Wen, President of the Planned Parenthood Federation of America, and the Planned Parenthood Action Fund, who will deliver the commencement address. Aparna Pooleri, the class of 2019, the undergraduate student speaker. At this time, I'd like to introduce and welcome our chaplain, who's a friend of the School of Public Health. We've done this several times before together, and Chaplain Tarif Shareem, who will lead us in a moment of reflection with the invocation. The university chaplains here represent many cultures and faiths and work collectively to serve the spiritual needs of the University of Maryland. Chaplain Shareem represents the Muslim campus ministry. Chaplain, if you will.
Today is a very special day. It's a day in which we celebrate with joy your accomplishments, the accomplishments of our 2019 graduating class at the School of Public Health. Today we come with hearts deeply thankful to our parents, our families, teachers, and mentors whose care, support, and affection have helped us reach this significant milestone. Today, let us enjoy the fruits of our labor and pause to remind ourselves that despite all the setbacks, all the dark moments, here we are. That even though life is hard and even though we do not understand, our trials are always sharpening us as iron sharpens iron and preparing us for bigger things that we witness later in our lives. As we proceed forward, may we recognize that we have the capacity and choice every single day in our lives to live an extraordinary life, and that this lies not in getting more, but in giving more. That we create much of our own unhappiness when we see what's wrong rather than what's right. When we look at what we don't have rather than what we have. May we learn to replace our self-limiting and self-sabotaging thoughts with thoughts of hope, joy, and abundance, understanding that our thoughts shape our realities and who we become, and that when we change the way we look at things, the things we look at change. May we decide to walk the path of those inspiring souls, that walk with a sense of humility and concern for every living thing, that see in others what they cannot see in themselves and do for them what they cannot do for themselves. The souls that are always on the lookout for ways to wipe the tears and raise others up, that have this knowing inside of them that whatever hope they pour into others will always find a way back to pour itself into them. May we learn to fight for everything worth fighting for in our lives, to see that our parents are worth it, our children are worth it, that our teachers are worth it, our students are worth it, Earth is worth it, that our marriages and friendships are worth it, that every dream planted inside of our hearts is well worth the fight. May we recognize our enormous potentials, and may we respond right now to the deep promptings of our world and in our hearts to offer our gifts and to bring out of ourselves and in others that which is most beautiful, most vibrant, and life-affirming. May we understand that when we do this, we'll begin to transcend our limitations and become far greater than we've ever imagined. May we live gratefully, and may we inspire and touch everyone and everything around us with our compassionate presence now and forever. Amen.
Please be seated.
Thank you, Chaplain, for your voluntary service to the university, for joining us today to commemorate this milestone in the lives of our graduates and their families, and for so eloquently putting this day into context, reminding us of the importance of embracing and being fully present in each and every moment, today and every day. Now I'm pleased to introduce Aparna Pooleri, who is earning her degree in public health science and was chosen to represent our graduating senior. Aparna is an undergraduate student who has made the most of her education at UMD, having taken on teaching, research, and service roles. She has served as teaching assistant for the course Human Anatomy and Physiology, has conducted research in South India on injury recovery, and is working to publish research on pediatric tumors. She is the president of Beta Psi Omega, the national co-ed professional biology fraternity founded here at the University of Maryland in 2010. She also works for AYUDH Americas, an international youth service organization, and is engaged in developing a vocational training program for women's economic empowerment in Afghanistan with the World Bank and MSI Consulting. She plans to pursue medical school and further degrees in public health after graduation. Ladies and gentlemen, give it up for your student speaker.
Yeah, I can get my phone. It's okay.
She'll be back.
Okay, sorry about that, guys. Thank you, Dr. Lushniak, for that introduction. Dr. Wen, fellow graduates, family and friends, and faculty and administration, thank you all for joining us this morning to celebrate the School of Public Health's graduating class of 2019. To my family, Amma, Acha, and Anand, thank you for your continued support in whatever I set my mind to. Also, to my prior students that I'm graduating alongside of, I know you guys thought you were safe when you handed in that final exam for Anatomy 1, but unfortunately, you're going to have to hear me lecture one more time. My fellow graduates, for the last 4 years, we have learned about the socio-ecological model, parts of the body, and maternal and child health. We've learned about environmental stressors, risk factors, and various health behaviors. After crossing deserts, streams, mountains, and valleys, we've gotten all of our daily steps in from just one trek to the School of Public Health. But what was it all for? As we stand here at the precipice of our next great adventure, let's reflect on why we're here in the first place and what we've learned in the process. When I was a sophomore, I had the opportunity to work as a hospital intern at a neurorehabilitation ward in South India, where I helped younger patients improve their cognition and dexterity through various games and activities. One patient in particular 16-year-old Nitul, had malignant tumors in his brain and spinal cord. A former cricket player for school, he was now left bedridden, stuck between the four walls of a hospital room with only his grandparents for company. Initially, he didn't emote much during our meetings, but as the weeks went by, he increasingly expressed eagerness in participating in our card games, coloring activities, and comic book readings. He told me that he enjoyed my company and that my sheer presence was making things a lot easier for him, even though I had only spent an hour a day in his room. At the time, I hadn't realized his cancer was terminal, or maybe I couldn't process that I would lose a friend. 4 months after I had left, he passed away, but the lesson he taught me will stay with me forever, that every small action in helping others makes a world of a difference, both to yourself and those around you. When you look at a discipline like public health, so much of it is rooted in selfless service. I'm confident that I'm not the only student here who has had an experience like the one I had with Nitul. We are all public health students, and we strive to help other people. I think no matter where we started, we were drawn to these 4 majors: family science, community health, kinesiology, and public health science. We were drawn to these 4 majors to do good. It wasn't for fame or for fortune, but to help as many people as possible. As graduates, thanks to the wonderful help of our mentors here at the School of Public Health, we are well equipped with the knowledge and skills to protect and promote both the health and well-being of all communities, and we must commit ourselves to upholding that responsibility. As Dr. Canham, the Executive Director of the UN Population Fund, so eloquently stated, the mission of public health students is the welfare of humankind. Let's continue to serve our peers, our family and friends, and the world around us. Let's give back to the community that has given us so much. We've all come from a wide variety of backgrounds, and even in our time here at the University of Maryland, we've pursued various double majors and minors. That's really where our diversity comes in. How lucky are we to be a part of something so diverse? We are future instructors, researchers, environmental scientists, and genetic counselors. We are aspiring doctors, health administrators, family therapists, and personal trainers. We are advocates for health literacy and policy. We are the voices of those who have none. Each of us brings something completely different to the table, and yet we're all unified under this all-encompassing umbrella of public health. It's so easy to isolate ourselves based on our distinctions, but in a time where everything does feel so divided, it's upon us to unite instead, celebrating our uniqueness in skills, talents, and experiences to make the biggest impact possible. In conjunction with the celebration of our diversity comes a commitment to lifelong learning. And by that, I don't necessarily mean pursuing other degrees. As the American novelist John Updike once said, "You cannot help but learn more as you take the world into your hands. Take it up reverently, for it is an old piece of clay with millions of thumbprints." The only constant in this tumultuous world of ours is change. As the field of public health is ever evolving, it is our duty as rising public health professionals to keep up with these changes. If Jon Snow, and no, I don't mean our favorite Game of Thrones character, if Jon Snow, the father of epidemiology, hadn't ignored critics and followed his inkling that the source of cholera began at the Broad Street pump, the outbreak would have continued to spread, and the field of public health as we know it would never be the same. In the same way Jon Snow's novel idea had such a great impact, our ideas are also powerful. We are powerful. Our ideas will shape the course of history. The School of Public Health has molded all of us into fearless leaders who, by learning from other disciplines and exploring our own interests, can come together to create effective and sustainable solutions for the public health problems we see today and tomorrow. No matter what our background is or what our future entails, it is now our time to move forth confidently into this world to inspire change and make a difference. With the world in our hands, it's time to leave our thumbprints. Go Terps, and congratulations, class of 2019.
Nicely
Thank you.
done. I'm sorry.
Thank you. Oh, are we hugging? Thank you. Thank you so much.
So as the dean, I can call audibles. And our commencement speaker is actually going to be next in line, and we'll hear from Melissa from the Alumni Association afterwards. Why? Because there's a lot going on in Dr. Wen's life right now. And unfortunately, she needs to get going right after commencement speech. She also admonished me to say, I can talk about her for the next half hour. We don't have time for that. Let me just briefly describe this incredible public health leader. She's been busy lately, as we all know. She serves on the Dean's Council here at the University of Maryland. I thank you for that support. She's been a tireless public health leader, now working with as the president of the Planned Parenthood Federation of America, the Planned Parenthood Action Fund, which she started working with in 2018. Prior to that, did incredible things in Baltimore, leading the health department there as the Baltimore City Health Commissioner, and dealing with multiple issues, right? Opioid addiction, gun violence, teen pregnancy, mental health issues. She's also a practicing emergency room physician. She's an emergency medicine physician. Also, part of the storyline, she is an immigrant to this country. Go immigrants. I'm the son of immigrants. We celebrate immigration to this country at this event as well. She came, born in Shanghai, China. She immigrated to the United States with her family just before her 8th birthday. Was that enough to sort of come in? She needed to excel. Summa cum laude from California State University. She graduated there at the age of 18. Yes, I said that correct. The age of 18, got her medical degree from Washington University School of Medicine, master's degrees, University of Oxford, trained at Brigham and Women's Hospital. She's done so many incredible things, but probably the highlight, I would say, and she would probably admit, is she became a parent last year of 1-year-old Eli. Ladies and gentlemen, our commencement speaker for 2019, Dr. Leana Wen.
All right, hello, class of 2019. What an honor it is to celebrate you, the public health leaders of today and tomorrow. And I hope you'll join me in giving a round of applause to our student commencement speaker, who was so outstanding just now. Aparna, thank you very much. So I'm thrilled to celebrate with you and to uphold your school's mission, which is the cornerstone of public health, to promote and protect the health and well-being of diverse communities throughout Maryland, the nation, and the world. And I believe that mission encapsulates what it means to be society's doctor. And that mission is exemplified through the leadership of your dean, someone I greatly admire and respect, Dean Boris Lushniak. So please join me in thanking a true public health champion, Dr. Lushniak. And we celebrate today, too, with your faculty and staff and your family and friends. Your graduation is their graduation, too. And to all those who supported you along the way, thank you for being here today and every day for our graduates. Thank you. So Dean Lushniak invited me to share some stories from the front lines of public health. I was most recently the health commissioner for the city of Baltimore, as you heard, and when I was there, one of the biggest challenges we faced, and still face around the country, is the opioid epidemic. And yet, even though the science is unequivocal that addiction is a disease, there's still profound stigma that's facing addiction. So in Baltimore, we recognize that addiction is something that affected all of us in the city. There's no face of someone who has an addiction. It could affect all of us. And so we got legislation passed so that I issued a standing order, a blanket prescription for the opioid antidote, naloxone, to every single one of our 620,000 residents in Baltimore. And I have to say, it's a little bit nerve-wracking to put your signature on 620,000 prescriptions. but in 3 years, everyday residents saved nearly 3,000 lives. And actually, that's why we do the work that we do, because at the end of the day, that's our North Star. Our North Star is the patients and the people that we serve. But you know, still there were people in our city who criticized our naloxone program by saying that it's only a short-term fix to the complex problem of addiction. And they're right, that we have to do a lot more to address the underlying social determinants that fuel ill health and despair. But while we wait for societal change, how many more people will die in front of us? We have to save lives today in order for there to be a chance at a better tomorrow. And so that's my first piece of advice to you graduates. Don't wait. Don't let the perfect be the enemy of the good. In public health, the problems we face can seem overwhelming. But we have to start somewhere, because there will be something that we can do right now. Don't wait until you have the most well-researched paper or the perfect job, although this is your graduation day and I do wish you both of those too. But I hope that you will go beyond studying the problem and be the one that steps up first and say, what can I do with the resources that I have right now? My second piece of advice to all of you is to don't let others tell you what public health can or cannot do. There are those who told our predecessors that they shouldn't dare to take on the tobacco industry, or that public health has no role in automobile safety or environmental regulation. Well, how many millions of lives are saved because public health leaders took on those industries and refused to be silent? It's been said that public health works best when we're invisible. But if we're invisible, nobody else is going to make the case for us. And then what happens? When it comes time to decide the budget, public health is going to be the first item on the chopping block. So you have to be that constant voice to talk about how eliminating emergency preparedness means uncontrolled outbreaks, how gutting Medicaid has devastating impacts for women and children and families for generations to come. And how cutting corners in environmental health is called Flint. So as one of my heroes, Senator Barbara Mikulski, says, data validate, they don't motivate. And we need both. We need the data, but you also need to be the motivator. And graduates, you are now the face of public health, and you cannot afford to be invisible because public health depends on you. And so here's my third piece of advice: to stand up and speak out. Because you know, these are challenging times that we live in. Perhaps the understatement of the morning. But so much of what we stand for are attacked on a political basis, or on a daily basis. And yet, there are those who tell us to stay away from these so-called political issues. Well, we are not the ones who have made healthcare political. And getting healthcare, getting cancer screenings, getting medications, that should not be political. Having access to the full range of reproductive health care, from birth control and yet safe legal abortions. Access to the full range of reproductive health services, birth control, cancer screenings, STI tests, HIV screenings, safe legal abortions, primary care. None of that should be political. But if others have made healthcare political, then public health has to fight back with everything that we have. In Baltimore, when the Trump administration slashed our teen pregnancy prevention program, we sued the Trump administration and we won. And now, as president of Planned Parenthood, I'm leading an organization that has to fight every single day just to provide essential health care to millions of people around the country. The Trump administration tried to impose a gag rule on Title X, which provides health services to 4 million women, men, and low-income families. Well, we sued the Trump administration in not one, not two, but 3 courts. We have won preliminary nationwide injunctions against this unethical and illegal gag rule. Just last week, and I'm sure you've all seen the news about this, Alabama just passed the most restrictive law on abortion care since Roe versus Wade was decided nearly 50 years ago. This law has no exceptions for rape or incest. And if a doctor who performs an abortion and tries to save a woman's life, that doctor could go to jail for life with a longer sentence than the rapist. And by the way, the law, that same law in Alabama and another law passed in Georgia and signed into law in Georgia, would allow the state to investigate women for miscarriages. As public health practitioners, we know the consequence. Women will be afraid to seek health care. And we know the data, that before Roe, thousands of women died because they did not have access to safe legal abortion care in this country. These bans will not stop abortions, but they will stop safe legal abortions. And the cost will be our patients' lives. And that's why public health's voice, our advocacy, our fight is more important now than ever. Public health demands courage. Public health demands speaking the truth. Always remember that standing up for public health, for the public's health, means that we will always be on the right side of history. And so I'd like to end today with a quote from former Secretary of State, Madeleine Albright, who said, "We sometimes misunderstand what leadership really is. We wait and listen for the sound of some mighty voice coming out of a loudspeaker. But real leadership comes from the quiet nudging of an inner voice. It comes from realizing that the time has come to move beyond preparing to doing." Well, graduates, your time to lead is here and now. Don't wait. Let's take action. Don't let others tell you what public health can or cannot do. We are the ones who have to make the case about how public health saves lives and counters disparities and injustice. Don't hesitate to embrace the risks and the challenges, because people are looking up to us to stand up and speak out because the public's lives depend on us. So thank you for the honor to join you. Congratulations to Dean Lushniak, faculty, staff, parents, and students. To the graduates, I applaud you, I celebrate you, I cheer you on in your journey to promote health and well-being of all. Congratulations to the class of 2019.
Thank you so much, Dr. Wen. And as a small token of our appreciation, here is a remembrance of this occasion. And so thank you. Continue to fight the good fight, and we are very proud of everything that you do. Thank you so much. Ladies and gentlemen, the commencement speaker for 2019, Dr. Leana Wen. So now we look into the future. And the future is taking place in just a few minutes as you get these diplomas. But part of this future orientation is what? You become not only graduates, you become alums of the University of Maryland School of Public Health and the University of Maryland College Park. I'd like to introduce the president of our School of Public Health Alumni Network, one of our graduates, Dr. Alyssa Todaro Brooks, to say a few words to our students. Alyssa.
Good morning, Terps, and congratulations to each of you on reaching this milestone. In getting to know so many of you, I've been inspired, not only by your academic achievement, but by your persistence in overcoming obstacles, your passion for implementing change, and your unwavering commitment to service. You are first-generation college students, veterans, poets, survivors, parents, artists, teachers, leaders, athletes, selfless servants, scholars, and so much more. Each one of you inspires me and makes me feel proud to be a Terp. One of the best parts of my job is welcoming brand new graduates to the School of Public Health Alumni Network, which consists of tens of thousands of public health Terps all over the world who are leaders and servants and out there building commitment to Maryland and to the School of Public Health. Today represents a celebration of what you've accomplished, but more importantly than that, it represents a vote of confidence in what you will achieve. The fact that you're here is proof that you've worked diligently and you've made the most of opportunities around you. I urge you to continue to embrace opportunities as you move through life. It is no secret that there's much work to be done, and because of your unique strengths, each of you has the power to contribute. We want you to stay involved, come back and mentor a student, help us with an outreach campaign, or represent the university while serving your community, because there is nothing more important or more honorable than service, but the possibilities really are endless. You have fearlessly promoted Health for All as students, and now I implore you to stay fearless. Bring us your ideas, your energy, and your passion for public health. We are proud to have you represent the university and the School of Public Health. Congratulations again.
Thank you, Alyssa. And we ask you to become active members of our alumni network. There's a lot of fun things going on, but also it's a sign of support and a sign of giving back to that next generation of students. That includes mentoring programs that many of you may have taken advantage of, but you can actually change the lives of our current undergraduates or graduate students just by being active. So thank you so much, Alyssa, for your activism in making our school a community. Commencement is the day on which the school bestows our highest honors upon our students, the bachelor's, the master's, and the doctoral degrees. At this time, I ask that Dr. Coke Farmer join me as we begin the recognition of our School of Public Health degree recipients. Coke.
Thank you, Dean Lushniak. Will those receiving a doctoral or master's degree please rise? Dean Lushniak, in accordance with the recommendations of the faculty of the Graduate School, I present to you those students who have successfully completed all graduate requirements for the Doctor of Philosophy, Master of Arts, Master of Health Administration, Master of Public Health, and Master of Science degrees.
Dr. Farmer, I acknowledge the recommendations of the faculty of the Graduate School and am pleased to extend my congratulations to each graduate for successfully completing all degree requirements. Will the Doctor of Philosophy and Master's degree recipients please proceed to the platform?
I would now like to introduce Dr. Stephen Roth, Associate Dean for Academic Affairs, who will present the recipients of the School of Public Health graduate degrees.
Receiving the PhD in Maternal and Child Health, Anthony Joseph Kondracki. Dr. Anthony Joseph Kondracki. His advisor, Dr. Marion Moser-Jones. Dissertation, The Prevalence of Maternal Smoking Intensity Status in Early and Late Pregnancy and its Association with Early Morbidity in Singleton-Term Births in the United States. Receiving the PhD in Maternal and Child Health, Julie Marie Fife. Dr. Julie Marie Fife. Her advisor, Dr. Amy Lewin. Dissertation, Family-Centered Pediatric Care, Predictors of Access and Associations with Child Well-Being. Receiving the PhD in Maternal and Child Health, Dr. Jessica L. Gleason. Advisor, Dr. Marie Toma. Dissertation, Reproductive Function, Examining the Long-Term Influence of Stress on Women's Fertility and Reproductive Health over the Life Course. Receiving the PhD in Family Science, Dr. Jenna Beckwith Messman. Her advisor, Dr. Lee Leslie. Dissertation, Transgender Inclusive Healthcare Services among College Health Centers in the United States. Receiving the PhD in Kinesiology, Dr. Stephanie Joan Cork. Her advisor is Dr. Shannon Jetty. Dissertation, The Physical Culture of Diversity Work, a case study of embodied inclusion and exclusion in American higher education. Receiving the PhD in Kinesiology, Caitlin Rebecca Esmond. Dr. Caitlin Rebecca Esmond. Her advisor, Dr. Shannon Jetty. Dissertation, The Datification of Everyday Life, Critically Contextualizing the Quantified Self, Movement in Physical Culture. Receiving the PhD in Behavioral and Community Health, Dr. Heather Nicole Platter. Her advisor, Dr. Bob Feldman. Dissertation, The Health Literacy Process Older Adult Long-Term Smokers Use to Make an Informed Decision About Lung Cancer Screening, a Grounded Theory Study. Receiving the PhD in Behavioral and Community Health, Dr. Nora Mueller. Dissertation advisor, Dr. Barbara Kerbo, hooded by Dr. Evelyn King-Marshall. Dissertation, Nothing to be Worried About Yet, Knowledge and Perceptions of Colorectal Cancer Among Individuals Below the Age of 50. Receiving the PhD in Behavioral and Community Health, Dr. Randy Marie Williams. Her advisor, Dr. Cheryl Knott. Dissertation, Decisional Needs of African American Smokers for Lung Cancer Screening. Receiving the PhD in Behavioral and Community Health, Dr. Liliana Fan. Her advisor, Dr. James Butler. Dissertation, Measuring the Single Cigarette Use Phenomenon, Scale Development and Validation. Receiving the PhD in Behavioral and Community Health, Dr. Neha Sharad Trivedi. Her advisor, Dr. Ken Beck. Dissertation, Social network influence of distracted driving behaviors, the role of proximal and distal relationships on texting while driving. Receiving the PhD in Behavioral and Community Health, Dr. Joanne Da Silva. Her advisor, Dr. Craig Fryer. Dissertation, Menthol Tobacco Sales Restrictions at the Local Level, Community Perceptions, Lessons Learned, and Policy Evaluation. Receiving the PhD in Health Services Administration, Dr. Andrew C. Anderson. Advisor, Dr. Louisa Franzini. Dissertation, Connecting the Dots Across the Care Continuum, Addressing Behavioral Health in ACO Networks. Receiving the PhD in Health Services Administration, Dr. Dima Al-Shawan. Her advisor, Dr. Louisa Franzini. Dissertation, Impact of Accreditation on the Quality of Services at King Fahad Hospital in Saudi Arabia. Receiving the PhD in Health Services Administration, Dr. Priscilla Joy Novak. Advisor, Dr. Ji Chen. Dissertation, Health Policy, Care Coordination, and Racial and Ethnic Health Disparities among U.S. adults aged 18 to 64 with serious psychological distress. Receiving the PhD in Epidemiology, Dr. Dina Huang. Advisors, Dr. Robin Pewitt and Dr. Qing Wan. Dissertation, Relationships of Social and Physical Environmental Factors with Cardiometabolic Outcomes. Receiving the PhD in Toxicology and Environmental Health, Dr. Jessica Chopik. Her advisor, Dr. Amy Sapkota. Dissertation, Diversity, Dynamics, and Dissemination of Microbial Communities in Reclaimed and Untreated Surface Waters Used for Agricultural Irrigation. Receiving the PhD in Toxicology and Environmental Health, Dr. Rihanna Teresa Frederica Murray. Advisors, Dr. Shakobi Wilson and Dr. Amy Sapkota. Dissertation, The Impact of Private Drinking Water Wells and Animal Feeding Operations on the Incidence of Acute Gastroenteritis in Maryland, a Mixed Methods Approach. Receiving the PhD in Environmental Health Science, Dr. Hillary Ann Craddock. Advisors, Dr. Amy Sapkota and Dr. Paul Turner. Dissertation, Water Reuse for Food Production in the West Bank and Israel, Assessing the Efficacy of Household Gray Water Treatment Systems and Consumer Perceptions of Reuse Applications. Receiving the PhD in Toxicology and Environmental Health, Dr. Jessica Ann Montresor Lopez. Advisor, Dr. Robin Pewitt. Dissertation, Exposure to Ambient Air Pollution and Correlates of Cardiovascular Disease Among Youth with Type 1 Diabetes. Receiving the PhD in Toxicology and Environmental Health, Paul Jacob Bueno de Mesquita. Advisor, Dr. Don Milton. Dissertation, Estimating Risk of Airborne Influenza Transmission in a Controlled Environment.
Congratulations to the Doctor of Philosophy graduates. And now for our master's degree recipients.
Receiving the Master of Public Health and Behavioral and Community Health, Felicia N. Davenport. Maria Elise Bowman. Julia Rose Marcus. Maria Eileen Amador. Nathaniel Woodard. Ayana Janelle Tucker. Amina Fazan. Shauna Rochelle Newton. Talia Marcel Wright, receiving the MPH in Epidemiology. Emily Jenkins. Xinyi Hua. Samantha Marie Ammons. Tuluwanimi Ogungbesan. Nicole Christine Haggerty. Angelica Lynn Burrell. Anna Catherine Long. Fianfula Adetunji. Maheen Humayun. Stephen Sheridan. Marwa Al-Nasser. Receiving the Master of Science in Couple and Family Therapy, Elena Sanchez Dominguez. Ashley Underwood Copeland. Stefania Elena Giorgio. Gabriela Anita Barber. Stephanie Ann Martinez. Emma Rose Leuven. Receiving the Master of Arts in Kinesiology, Tori Alexis Thompson. Receiving the MPH in Physical Activity, Brandon Lee. Receiving the MPH in Health Equity, Simone Isaacs. Morgan Lynn Wigan. Kristen Marie Valentina Rodriguez Mejia. Lana Duarte. Cassandra Hendry. Receiving the Masters of Health Services Administration, Allison Laura Burt. Pamela Elizabeth Vega Mejia. Nicole Taylor Stevenson Monroy. Selena Lillian Castillo. Joanna Romero. Ama Brown. Amari Riley. Jasmine Monet Aldrich. Receiving the MPH in Health Policy Analysis and Evaluation, Krishna Patel. Surya Kareem. Ada Thapa. Janae Sakanda Hollinger. Uni Choi. Deepjyoti Deb. Kristana Paris. Receiving the MPH in Public Health Policy and Practice, Melanie Janine Meese. Cynthia Maria Luisa Rojas. Olivia Marie Hussey. Rebecca Piuza. Melissa Mera. Christina Francisco. Corinna Elena Bonk. Ashley Shanika Duverneau. Erica Goldberg Haredni Chanu. Kara Kenny. Layla Nayer. Temi Tope Adabiye. Paul Robajan. Zema Naheen Mirza. Receiving the MPH in Environmental Health Science, Dana Ann Buckholz.
Congratulations to the Master of Arts, Master of Health Administration, Master of Public Health, and Master of Science degree recipients.
Will those receiving the Bachelor of Science degree in Public Health Science please rise? Dr. Stephen Roth, Director of the Public Health Science Program, will present the degree recipients.
Dean Lushniak, in accordance with the recommendations of the Public Health Science faculty, I present to you those students who have completed all graduation requirements and are recipients of the Bachelor of Science degree.
Dr. Roth, I acknowledge the recommendations of your faculty, and I'm pleased to extend my congratulations to each graduate.
Yeah, and have him come out.
Yeah, right here.
Gabrielle Gao. Sydney Patricia Lucas. Rosemary O'Shea O'Connor. Madison Mackenzie Smith. Milena Rose Prudhomme. Colleen Mercedes Keating. Heinia Rockney. Lisa Hen. Justine Marie Humbach. Aparna Pooleri. Rohini Nambiar. Arturo Shantano Deshpande. Katie Lynn Leidick. Catherine Elizabeth Bowling. Madeline Mariel Litwin. Tanvi Valsangakar. Joshua David Hernandez. Sydney Nicole Frost. Alec Stephen Walter. Seth Evan Bagley. Christine Shu. Courtney Nicole Harvey. Heather Quishelle Hayes. Nania Owusu. Afnan Jimmy. Anna Stacy Joseph. Athanasia Papadopoulos. Alexis Carolyn Schmidt. Alexandra Brown. Stefan Matthew Antoine. Aja Yao Adamako Aaron. Oluteo Alainka Adewumi. Darian Samuel White. Milky Safi Hussein. Diepso Abbormai, sorry, Abbormai. Calisian Ojai McLeod. Abigail Lee King. Mallory Clinton. Emily Ann Wang. Elizabeth Katchen. Theodore Lewis Gold. Jonathan Vance Lewis. Anjali Shanmukan Malur. June Solo. Caitlin Rita Holmes. Caroline Louise Simon. Emma Tabakan. Mira Ramana Amu. Anna Elizabeth Geyer. Hannah Marie Scully. Nofar Yarden. Rachel Venjowski. Vincent Alexander DeMeo. Deja Faye Tolbert. Joanne Lamb. Cortland Daniel Kim. Krista Ellen Hinchman. Roja Kambampati. Davika Haridas. Erin Kathleen Murphy. Jessica Tao Nguyen. Caitlin Ann Pownell. Melinda Peterson. Alexandra Michelle Gaia. Paula Escott. Matthew Guevara. Carlin Fulton. Stephanie Roth. Matthew Lawrence Pruse. Lucas Parker Hansen. Forum Patel. Kushbu Patel. William Owusu Ansa. Temitopai Adejatuniji. Jordan Adele Kerr. Akeem Jamal Henry. Yasmin Ufufa Tambunde. Makwachi Chebuka Akwanafe. Olade Salare. Anthony Ajapong. Yassine Malika Bai. Paul Dong. Anida Gomes. Layla Stephanie Merlot. Our next victim, Kathleen Teresa Barr. Kenya Michelle Fernandez Ortiz. Nessa Riliorto. Max Avery Pennington. Gabriella Marie Arp. Sarah Catherine Cooney. Megan Victoria Bob. Gloria Esosa Ecator. Rachel Aluasani. Carly Abrams. Amara Nicole Fox. Bethel Sherwega Areda. Amy Mary Augustine. Jinyi Zhu. Emily Yun. Teresa Ann Menacheri. Jenna Lee Bugoyas. Jarlene Banny Flores. Dalton William Robertson. Joseph William Padula. Array Takor Ayuka Ray. Rachel Marie Wisner. Mohammed Kamran Ayub. Caroline Hoggle. Jordan Mansfield. Nicola Aurora Sharkey. Rebecca Julia Tamilchik. Regan Farnan. Cindy Linda Lufsey. Corey Friedman. Oh, I'm sorry. Thank you. Shakinga Masanya Kaminu. I'm sorry. Halia Lankarani. Olawatoyan Temitope Awatunde. Paige Elizabeth Hunt. Kaylee Alexander. Anusha Kalakuri. Michelle Atmar. Lena Warwick. Nisha Joshi. Jordan Chase Maddox. Jimmy Song. Connie Chung. Daria Aiden Khan. Ashley Christine Ellis. Lauren Juliana Guerrero. I'm sorry. Kira Sally Galena. Cheryl Brenda Xavier. Kiam Abadir. Javon Hogan. Yusuf Hisham Ahmad. Julia Ann Wagner. Brittany Ann Stone. Maggie Chang. Jerry Zhang. Margaret Chen. Jimmy Bowie. Melissa K. McDaniel. Tatiana T. McDaniel. Molly Hale Lutry. Christina Lee Corral. Camille Elise Alexander. Zaria Diamond Fife. Imani Braxton Allen. Matthew Robert Vogt. Ujval Saravanan. John David Barizo. Saren Nevaretnam. Hargeet Singh. Sunmeet Kaur Singh. Nadia Manood Alvi. Saman Tanvir. Sana Isaac. Anyeka Aziz. Bria Good. Nina Shanalaz. Dana Hong. Antara Joshi. Naomi Shalina Mora. Sorry? Jasmine Teray James. Alexis Caitlin Mooney. Spencer Kim Shell. Mara O'Shea Linz. Shaylee Sanjay Chef. Marta Catalina Villafania. Bailey Breeden. Henna Latif. Selena Ha. Lauren Elizabeth Dyke. Lauren Sukri. Cindy Lynn. Monica Hyan Park. Caroline Rosebell Wong. Layla Zarfan Shanfard. Azeen Farahani. Renette Desiree Thompson. Betsalat Baruch Wandamu. Ornell Kiliwan Guantumishishi. Changmin Jonathan Hyun. Glory Ojera Owe. Ochechi Nwaneri. Olabisi, sorry. Olabisi Olatukambo Balogun. Miko Graves. Ugoshi Chinmera. Kadiatu Sengason Sise. Jeriatu Jambai. Hello. Queen Amanda Bentil. Hayes Zhang. Reina Portillo. Libyan Anoki. Sake Brana. Tasmin Islam. Shufa Misana. Ajua Amankwag Asayar. Bontu Fita. Bethlehem Mamo. Amicius Aquilil. Dina Haddad. Oliver Mariquin. Jaime Maher. Janet Atera. I know. Hold up. One from here. Brittany Miami Ishan. Oyenye Akina Okudo. Kaima Deshay Clark. Will those receiving the Bachelor of Science degree from the Department of Family Science please rise?
Dean Lushniak, in accordance with the recommendations of the faculty of the Department of Family Science, I present to you those students who have successfully completed all their graduation requirements and are recipients of the Bachelor of Science degree.
Dr. Quinn, I acknowledge the recommendations of your faculty, and I'm pleased to extend my congratulations to each graduate in Family Science.
Yeah, I think so.
I was just thinking, because if we get them right at the ramp.
Yeah.
Okay. I mean, okay, so Family Science and Health should not take too long. I feel like we started Public Health Science around noon. So we need 30 minutes for police, which is what we're at right now.
There we go.
Well, and the good thing.
How are you doing?
I'm all right.
Thank you. You're hanging in there. It's just
Trying to keep me in
yeah,
order.
yeah.
What's at the end? Do we have to cut anything at the end?
I mean,
Doubt it.
there's not that much of
Do you
it.
think? Well, let's see where we are. Hold on.
Ryan Wesley Deal. Congratulations. Alfred Jeffrey Bannister. Christina Dahe Lim. Hannah Jordan Brockstein. Anastasia Elena Hilburn. Sabrina Sermeno. Sabrina Maria Alimi. Jose Mario Salazar. Kelly Marie Jones. Mason Harrison. Jasmine Zola Jack. Clark Desiree Brooks. Shayla Stringfield. Nicole Hillary Lynch. Hannah Tippett Becker. Anne Marie Simon. Peyton Brooke Foster. Alam Akmel. Jocelyn Gumdaran. Sierra P. Golson. Rebecca Goldstein. Olivia Rose Kaufman. Devora Tova Berkowitz. Dominique Ledon Simmons. Deja Lene Simmons. Megan Celeste Palmer. Sandra Gacy Alexa Powell. Lara Galvao Conceso. Sally Alicia Kiker. Sabrina Christina Cito. Alexa Blair Liss. Alexandra Michelle Hosner. Kelly Jeslinas Reyes. Elena Greenbaum. Ariana Mae Jarvis. Andrea Rose Jarvis. Rebecca Ann Pruitt. Celia Barrientos. Monica M. Orlano Barrientos. Yancy Mayorga. James Sherwood. Stephanie Elaine Birmingham. Mariella Leonor Trejo. El Shaddai Zalalam. Katerina Kittelberger. Adriana Mario Jimenez. Timothy Dawson. Sephora Colelas. Aliyah O'Neill. Itala Micheli. Kingsley eBay. Albert Andy Botchway. Ryan Benjamin Stern. Van Dorian Lingua Take-It. Ayodeji Ayoko. Dejeuner Nautica Jefferson. Lauren Bree Morton. Asia Nanzette Adams. Kelly Artina Olive. Jordan Renee Glenn. Leslie Jamilat Rivera. Marianne Carmen Salazar. Shui B. Cheyenne Nicole Richardson. Parastui Zizarafi. Paige Alexandra Kraus. Caitlin Nicole Maynard. Tamai Anira Taliver. Shayna Burke Levin. Gretchen Van Winter. Kathy Marlene Gonzalez. Crystal Dawn Giardin. Imani Crawford. Sarah Ahmed Tayel. Megan Schulte Runnels. Tallulah Rain Miller. Chiamaka Chikaze Manduka. Albright Manuela Akui. Helen Richmond. Will those receiving the Bachelor of Science degree from the Department of Behavioral and Community Health please rise? Dr. Bob Gold will present the recipients.
Dean Lushniak, in accordance with the recommendations of the faculty of the Department of Behavioral and Community Health, I present to you these students who have successfully completed all graduation requirements and are recipients of the Bachelor of Science degree.
Dr. Gold, I acknowledge the recommendations of the faculty, and I'm pleased to extend my congratulations to each graduate.
Zechariah Dylan Khalil. Avery Malay. Christina Noel Higgins. Rolando Flores Lopez. Jake Lewis. Owen Reed O'Keefe. Oluwatomini Beatrice Okenlawawan. Nakwaya Aaliyah Brown. Opilawa Peter Salalu. Naira Clara Joseph. Jason Paligua. Jeffrey Umanazor. Lois Dyer. Amanda Abrafri Amankwa. Nanu Kalu. Talia Bell Klein. Rachel Spawns. Eric Robinson Hoffmeister. Hannah Bergen Lee. Jordan Kotler. Emily Boutel Robb. Margaret Mary Siner. Samantha Ann Martochi. Natasha Shaw. Benjamin Breyer. Flora Lee. Claudia Ham. Rosie Chacon. Maya Loren Pugero. Melissa Ann Smith. Alexandra Bonney. Rachel Marie Baker. Erin Christine Finnessy. Jessica Lauren Gold.
All right, well done. All right, just go.
Will those receiving the Bachelor of Science degree from the Department of Kinesiology please rise? Did I just say that?
It's the only one we have left.
Dean Lushniak, in accord with the recommendations of the faculty in the Department of Kinesiology, I present to you those students who have successfully completed all graduation requirements and are recipients of the degree Bachelor of Science.
Dr. Hatfield, I acknowledge the recommendations of your faculty, and I'm pleased to extend my congratulations to each candidate.
Hanging in there?
All right.
Doing a great job.
Okay. Come on up. Whisper your name in her ear, okay?
Madison Kathleen Kirchner. Morgan Brianne Baca. Anna Teresa Carmen. Ashley Brianna Graham. Allison Nicole Bailey. Elizabeth Mahalik. Sarah Moscone. Samantha Nicole Main. Jenica Veronica Surdick. Sean Alexander Jackson. Gaetano Thomas Acusella. Emily Taylor Bracker. Mackenzie Lauren Davis. Michaela Simone de la Cruz Ada. Paige Chi. Allison Taylor Scott. Neil A. Calabrese. Catherine Marie Costello. Amber Jade Oliveri. Litao Alfasi. Tara Caitlin Lanahan. Eshi Daliwal. Joshua Halprin. Aaron Latoff. Anna Konkin. Antun Pham. Autumn Monarani Potter. Sarah Paige Smith. Peyton Marion Cassidy. Star DeHart. Christopher Swift. Sarah Lindsay Myers. Jacob Walter Funk. Deanna Marie Magro. Kirsten Peterman. Samantha Lee Costanza. Lauren Kathleen Colleton. Caroline Lisbeth Campbell. Sarah Ann Kowalczyk. Maria Rebecca Matthews. Isabella Marlene Riva. Jasmine Simone Jones. Rachel Stern. Jillian Silverman. Isabella Bokumjon Wu. Catherine Michael. Mariah Deanne Sakalaris. Priscilla Marie Lansaw. Anne Michelle Werner. Katie Stevens. Isabel Nicole Minkin. Catherine Kelly. Kendall T. McDermott. Caitlin Washer. Robin Scarlett Wagner. Megan Grace DePeace. Natalie Ray Flynn. Abigail Lee Masucci. Alex Enrique Hernandez. Nelson Charles Slade. Kayvon Monami. Abeche Agobesa Nadumbi. Kevin Grant Rosofsky. Daniel Gross. Nicole Feigenblum. Shira Clements. Alec Gasson. Caroline Saltzman. Jacob Coleman. Julie Clark. Laura Alejandra Munoz. Patrick Heo.
Yeah, Patrick!
Human Beck. Christian Spriggs. John Russell Etherton. Jason Sung-Young Lee. Jinhong James Kang. Jordan Bruce. Matthew Chen. Madan Kumar Anti. Alexander J. Neal. Avane Vijay Kumar Patel. Jared Michael Rodriguez. Aaron Danielle Rahim. Connor Roman Chavez. Benjamin Michael Johnson. Zachary Jacon Kircher. Christina Mackenzie Campbell. Katie Parmentier. Lisa Chernova. Stephen Alexander Besterman. Jonathan Getty Flowers. Jonathan Andrew Kimmett. Khalil Edwards. Kevin Kwong Tran. William Stephen Parr. Amanda Elizabeth Singer. Carlos Flores. Elena Carol Daños. Sandra Ray. Nicole Sender. Tevin Charles Lucky. Jasmine Fatime Gashti. Sydney Jackson. Mary Jean Iowa Hunter. Catherine Ann Benson. Santiago Abe Romero. Brian Sao. Kai-Son Wu. Tuan Din. Hai Vu. Rebecca Jane Glazer. Hope Nicole Randolph. Eduarda Peters. Mohammed Zulfikar Hussein. Jacob Restrepo Bonet. Jose Oswaldo Mongandi. Marvin Adrian Martinez. Kenneth Ryan Goraspe Montemayor. Madeline Cleone Nillis.
Grant Edward Simmons.
Grant Edward Simmons.
Vincenzo Thomas.
Vincenzo Thomas Saccone. Brooks Anthony Overtomb. Amanda Claire Hodgetts. Brody Aaron Niesman. Brittany Michelle Packard. Victoria Chu. Anthony Amici. Gujri Chada. Kevin Lynn. Rashid Oradedi. Nathan Daniel Stock.
Jeffrey Emmett Son.
Jeffrey Emmett Son. Anne Elizabeth Johnson. Nigel Keene. Tyler Michael Szywinski. Louise Ann Zimmerman. Adam Charles Batista. Andrew John Stagg. Victor Odemegwu. Brandy Bertie. Danielle Pickens. Kayla Lynn Roan. Caitlin Rose Adams. Adam Daniel Iberius. Abby Helena Logbo. Daniel Christopher Aseke Dagdag. Brene Ashley Gossaway. Adib Javed Mateen. Mara Anchana Miller. Alex Nguyen. Joao Manuel Lopez. Jennifer Rebecca Vasquez. Jacob Huey. Mark Houston. Ryan Hagwan Jang. Joshua J. Kim. Gaston Aswan Asoy. Steve Namdi Iziani. Donice Cox. Cynthia Raquel Vito. Brendan Paul Weinhold. How do I say your middle name? Christian Faraja Traore. Sean Rafty. Scott Francis Kenny. Constantine William Kutson. Micah Salzberg. Elon Daniel Rubin. Matthew Alexander Rodriguez. Kathra Inwa Kim. Juliana Victoria McCreaney. Kathleen Aaron Stafford. Uzman Celia. Nana Arhin.
Anthony Onyekachi Nduka.
Onyekachi? Yeah. Okay, hold on.
Anthony Onyekachi Nduka.
Anthony Onyekachi Naduka. Are you the last one?
So Diana Fema Sarnor. Fema like the boat, you know.
Diana. Fema.
Yes.
Okay.
Sarnor.
Diana Femur Sarnar.
Oh my god. Alright. Is he gonna like end it?
Wow. Congratulations to the Bachelor of Science degree recipients. So as we close this ceremony, we do want to acknowledge there are bachelor's degree recipients who have earned Latin honors. The summa cum laude, magna cum laude, and cum laude are the highest commencement honors that the university confers for sustained excellence in scholarship. They're awarded to the top 10% of all students graduating in the School of Public Health over the course of a year. Summa cum laude is awarded to students with a GPA in the highest 2% of all college graduates, magna the next 3%, and cum laude to the following 5%. Will those students graduating with Latin honors please stand? Thank you. Well done, scholars. Well done. This pathway you've been on, right? We've gone through this ceremony. The pathway you've been on doesn't come as an individual. It comes with the support of family and friends that are here. Graduates, please acknowledge the support of those individuals who've been there over the course of your scholastic journey. Thank you, families, for being part of this. At the same time, this doesn't come easily without faculty. I want you to acknowledge at this point the faculty, but in particular, people who have had years of service here at the university that are extraordinary. Ken Beck, 40 years, stand up. Robert Feldman, 40 years. Betty Brown, 39 years. Elaine Anderson, 38 years. Seppo Iso Ahala, 38 years. Norman Epstein, 36 years and now retiring. Lee Leslie, 36 years. Laurie Simon Razinowitz, 21 years. Let's hear it to all the faculty members, but in particular, the people who've been out there. And now, the tradition, right before we go. This is the moment you've been waiting for, sharing in the age-old tradition. Would all of the School of Public Health degree candidates please rise? Aparna, please join me in leading your fellow graduates. Grasp your tassel. This is important. Something magical happens. Grasp your tassel. On the count of 3, Aparna, you're going to count it off. Turn your tassels from the right, that's this side, to the left, that's that side, signifying this new beginning. Ready?
1, 2, 3.
Way to go. So, in closure, you can be seated for a second. In closure, we got to get out of here because the business school comes in at 3 o'clock, right? So I'm asking everybody, it's okay. They're friends of ours. But that being said, I ask everybody to meet over at the School of Public Health for our reception. Families, the quicker that we can get out of this building, the better. We ask you to reach out to your graduates there at the School of Public Health. A lot of good photo ops. We'll have a photo booth set up in the Friedgen Family Seminar Room. This is a great location for those photos. And in essence, in closure, I'm going to ask you just to remember 2 words. And these are words that are embedded in our philosophy here at the University of Maryland, certainly within our philosophy of the School of Public Health. You have now are walking away with a piece of paper. It's just a piece of paper. It, however, acknowledges, symbolizes the years of effort you've put into getting this education. The path now is clear. The two words are, do good. As we close this ceremony, will the audience please remain seated while the platform party, the faculty, and the graduates exit during the recessional. Ladies and gentlemen, it's been my pleasure to be here as dean, and this is one heck of a great send-off for you. But don't forget, commencement is the beginning. Do good.